So we've talked about the generalities of program planning. What I thought we would do now is look at a specific service that we have developed as part of our Healthy Living program, and that is mobile intervention. And what we're going to do over the next several slides is hopefully demonstrate how this idea came to being, the discussion around whether or not we were going to deliver this service, and then the process by which we develop the actual program plan. The mobile intervention piece is a somewhat later product of our program. We had been running the Healthy Living Project for 2 to 3 years prior to the idea of mobile intervention, and there's a reason for that, and we'll get into that in the next few slides. From our perspective, so what is mobile intervention, just so that we're all on the same page, and the slide speaks to it fairly accurately. It's the use of social media, telephony, texting to routinely check in with participants to encourage their pursuit of their health goals. So it's a method of connecting with people that is not something that Community Matters would normally have done. We're very much an organization that gets a lot of positive results through physical interaction with people, meeting people in the community, and having them participate in our programs. So to be able to provide a service through social media and telephones and texting is something different for us. But it is a way of touching base with people that we were unable to touch base with because of their own particular lifestyle. They may be working when our programs are offered. They may be working. They may be helping their children at school. There's many reasons why they would not be able to come to our programs or to have direct contact with us. And so we were looking for other ways to contact and support people when we were considering this mobile intervention. And we'll kind of come back to this in a minute, but what we have found is that the mobile intervention works best as a support for something that's already in place. And so if somebody has a health goal of eating so many servings of fresh fruits and vegetables a day, they've already come up with that goal. And what the mobile intervention does is to be able to provide additional support for them to achieve that goal. Okay, so to go into a little bit more detail, why are we doing this? Why did we choose this mobile intervention? How did it come to the table for us to even discuss? And I want to go back to the discussion that we had previously about a ground-up approach to how we offer service in the community. So the first thing that comes to mind when we think about mobile intervention is that it is a response to something that was asked for by existing participants. They were already part of our programs, or they knew of our programs, and what they were looking for was additional help in achieving a particular health goal. So it started with the community asking for a particular service. It started with the community asking for something, and that's the way that all Community Matters programs start. They start at that community level, at that very basic ground level. And in this particular case, because the participants had come to our programs, they had decided that they did want to improve their health. They knew how to improve their health, but the one thing that was missing was an ongoing support for them to take the actions that they knew that they had to take. Let's say, for example, that they needed to eat 3 or 4 or 5 servings of fresh fruits and vegetables each day. It's easy for us to say that, any one of us to say that as a goal. Doing it is an entirely different thing. And to have somebody call in and see how you're doing on that particular goal, or text you or contact you through WhatsApp, just as a reminder, what we found was that our residents and our neighbors really, really benefited from that. Another part of it is that sometimes residents are somewhat reluctant to come to a program and discuss their health issues, and so the mobile intervention provides a privacy that direct contact and physical participation in programs does not achieve. And so it enabled us to open up a window to residents and neighbors that we were not previously serving. And that was a really interesting part of this particular initiative, because we had wrestled with those people that want to, for a variety of reasons, or need to, or must stay in their apartments and do not socialize that much. So before we get into all of the details of program planning, we want to first of all talk about how it's very important to talk about how this all starts. It's kind of like building the basement to a house. You get that basement right and the house goes up relatively smoothly. And so for this particular service to work, it needs to start with the neighbor wanting to feel the need to set a health goal. And once again, it goes back to that grassroots, ground-up approach. Unless I want to improve my health, all the services in the world are not going to help me. I need to want to improve my health. And so we have a process to engage neighbors who may want to improve their health, or it's in the back of their minds, but they're simply too busy to focus on themselves to improve their health. And so there needs to be a way to engage those people so that they can start to at least talk about and think about doing something about their health that may not be as onerous or difficult as they originally think it's going to be. So first of all, the neighbor or our friends need to want to improve their health. And then we need to have a process to engage them in doing exactly that. Once we have people prepared to set a health goal and we have a process of engaging them so there is some level of commitment, there are many ways in which you can support residents in achieving that. Some people, quite frankly, prefer to come to a program where they can do Zumba or they can do a nutrition class, and during that time they can engage in their own discussions around how well they're doing with achieving that particular health goal. In other cases that we've mentioned earlier, people are either not comfortable in talking about their particular health issues and their health goals, or they simply do not have the time to come to our programs, or are simply not available at the times that we offer our programs. So the mobile intervention was an enhancement to the support that we already give to residents and neighbors within the community. So once again, before we get into the specifics of program planning, I want to go back to the previous slide and talk about the need to engage and how do we engage neighbors and residents within our community. And this process that is here is we basically use for any particular program and anything that we are doing in the community. And the first thing you have to do from our perspective is meet the needs of the neighbor first. We may have a desire to offer a nutrition program, but if the neighbor or the friend has questions about the school system, or how to get a doctor, or how to find a hospital, or how to face whatever the challenges they have as a newcomer, they're not going to spend a lot of attention or time with us because they have their own needs. And we need to demonstrate first as a neighbor that we're prepared to support them before we ask them to start to participate in programs which we believe will be beneficial to them. Quite often we'll have newcomers in this community worried about how they're going to pay their rent, where they're going to get a job from. Many, and as I say, school system or whatever, many questions. Before we can engage them in our programs, we need to answer those questions and support them first. And that is the most important element of engaging our community. I think once we've done that, we have started to build a relationship. And so then we start to develop a familiarity. And so we meet people that we've helped and answered their questions at community festivals. Maybe we meet them as they're dropping off their kids, or maybe we meet the grandma when she's dropping off the kids at schools, and maybe at some sort of program we have. So for example, we have a walking program that starts at the school after the mums or grandmoms have dropped off the children. We ask people simply to join us in a walk around the schoolyard to gain exercise. And just from strictly a social perspective, just to engage residents and to start some level of communication. And then it's a matter of encouragement. Once somebody has joined us first for a walk, then we invite them back the next day. They see us in the community, they see our faces within the community, and they're more likely to want to talk to us about issues and to listen to us. So to us it's very important. Meet the needs of the neighbor first. That's the most important thing to do. Be consistent in seeing them and engaging them in community events and festivals and the things that go on in our neighborhood. And then start the process of encouragement to look after themselves from a health perspective. So carrying on with this process, what we've now done is we've met with our neighbors, we've met their needs, we've met them in the community, we've developed a sense of familiarity with them. We're starting to potentially get them involved in some just general programs such as our walking program in the community. And so we're starting to develop a relationship with them. And during those general programs, we start to engage in conversation that naturally leads to some discussion of personal health or general health in particular. In this particular community, it's a very dense community. There's not a lot of areas for exercise. There's not a lot of resources for kids, et cetera, et cetera. And so that creates the need for conversation. Inevitably, those conversations start when we start to talk about health. We also start to talk about more specifics. Maybe it's weight. Maybe it's somebody having a heart attack. Maybe it's somebody that has cancer, either directly in the family or a relative back home, or somebody that we've known. And so quite often we will not only ask that question of people, but we will start that discussion by sharing our own stories of relatives, ourselves, people we know that are experiencing some level of health issue. And so that's where the communication and the conversation around health begins. From there, the process starts to become more specific. If, for example, it's about diabetes, we know that there is a huge benefit, especially in a very dense community such as this, where there are very few facilities, to exercise and to participate in some level of health programs that's going to provide knowledge around food or nutrition or physical health. And so they've already started to participate in our walking program, and it's relatively easy to ask them to then come and participate potentially in a volleyball program, swimming for their kids, or a Zumba program, or a nutrition course. So we have now started to begin much more specific. Once they get involved in those programs, then what we do is it becomes a natural part of the process for somebody to want to set a health goal. So if they want to develop physical health, maybe we'll encourage them to climb two levels of the stairs in their apartment building before they take the elevator. If they want to improve their eating habits, maybe we'll encourage them to purchase more fruits and vegetables. And not only that, our nutrition programs will then help them to create different ideas around preparation. And at some point in that process, the neighbor or our friend decides that they want to improve their health. They want to lose weight. They want to do something that is going to improve their overall health. So they set a goal, and then they need encouragement. Now, we can encourage them as we see them in the community, but what we have found is that encouragement works much more if we can do it on a regular and consistent basis, hence the need for, or the opportunity with the mobile intervention.